Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. You can speak live with Dr. Darrow, and you get a free book when you call the show. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by the lovely Suzanne Somers. And you actually appear in her latest book also, A New Way to Age, right?
Yes, I do. Thank goodness, Suzanne Somers. I do love you. You're a good buddy. And not just that, not only are we great friends, but I think Suzanne is one of the most amazing people on the planet. She has promulgated and advanced the cause of natural medicine more than any other person I know in this age. So my hat goes off to you. There you go. I'm taking my hat off, tipping my hat. I'm on video right now, too.
Very cute.
And God bless you, Suzanne Somers. And I do appreciate you writing about the work that I do and helping bring it out to the public, because we know that surgery is on the downside with musculoskeletal medicine for the kind of things that I can heal with regenerative medicine with just simple injections rather than cutting open the body and having all kinds of side effects. And Suzanne has had this done. I've worked on her family also, and we've had great results. So Suzanne Somers, thank you so much. And I'm going to be sending out this book for free. It's got a foreword by Suzanne Somers here. And anybody that calls into the show and wants to talk to me about your issues or your friend's issues, the number to call me right now, get your pencil, 800, no, it's not, it's 866-870-5752, 866-870-5752. I'm also going to give out my phone number to the office in case there's information we didn't cover here that pertains to you or your friends or family. And that number to the office is 800-300-9300. Once more, 800-300-9300. And then if you want to watch me doing procedures, there's videos on my website, and that website is www.lastemcells.com, lastemcells.com. It's a huge website. There is endless information and research about using platelets and stem cells, and I think it's a great read for anybody that is interested in healing the body without surgery. So a couple other things, Nita, I want to mention that in the office we also do the vampire facelift, which is injecting the face with stem cells or platelets to help regrow the collagen, make you look young again. And also we can do that on the top of the head to regenerate and thicken the hair. Yes, there are studies about that. Believe it or not, they're in my book. Towards the end, there's a chapter on the hair and on the face. So there's research that goes along with it. Everything that I do is research-backed, and we do research in the office. I've had, I don't know how many, probably 30 or 40 students wanting to go to medical school, or usually people that are in medical school that want to get a good residency. They want to do research. So we've published a bunch, and we're publishing more. And I have doctors follow me all the time from around the world, and a lot of students follow me. It's called shadowing. I tell them when they come in, you're going to be a fly on the wall. That means flies don't talk.
So, well, I was just going to say, do you want to talk to Duke in Hermosa Beach by chance?
I was hoping you'd tell me to do that, Nita, because I'm looking at other stuff here.
Okay.
Hey, Duke.
All are you, doctor? How are
I'm
you?
living it up, living it up. How's your left heel?
Okay, well, the last couple months, discomfort because that trick and the.
Hey, Duke, you cut in and out. Are you on a cell phone somewhere?
Yeah, I'm
Bluetooth?
on a cell phone.
Can you?
Hold on a second. Yeah, I'll
Yeah.
improve it. Hold on. Let me
Thank
turn
you.
off the speaker. Stand by.
You got it.
Okay. Okay, is that better?
Oh yeah, that's perfect. Thank you.
Okay, here's what's going on in my left heel. MRI shows a bone bruise and a slight tear in the fascia and a bone spur. That's why I call it the hat trick.
Yeah, you got it. All three at once. So you have a
So
bone.
I'm
You have a bone
fan of-
bruise. You have fasciitis. The fascia is inflamed, and then
Yes.
you have a spur. Can I deal with
Right,
these
and
for
I'm
you?
a big fan. I'm a big fan of PRP. It
Oh,
healed
good.
my left knee, and I was wondering if that would help in my heel.
I think so. I haven't touched it yet to tell you, but generally, yes. How did you injure yourself and how long ago?
I do not know how I injured myself. I went to a 3-day rock concert in Redondo Beach, and there was no injury notable.
But you were jumping up and down a lot? Hello?
Are you there, Duke?
Duke has phone problems. Let me answer some of this anyway, though.
Okay. Let's give the phone number so he can call back. It's
Yeah, Duke, if you want to call back, it's 866-870-5752 to talk to me again. But I'm going to talk about your heel. I'm sorry that you somehow your phone cut you off. I see a call coming in. It's probably Duke again. So, Duke, the story is if you went to a 3-day rock concert, you were probably jumping around quite a bit. I was just at a party where there were about 150 people there on the dance floor jumping up and down. Now, back in my day of rock concerts, people didn't jump; they danced.
okay. Duke is back. I'll bring
Yeah,
him on.
there wasn't much dancing going on, Duke. There was a lot of jumping up and down. And if you were that guy jumping up and down, you have good reason to have injured your calcaneus, your heel bone, and injured the fascia. But you also have a spur, which didn't happen at the rock concert. That takes time, and that's what we call arthritis. And I'm going to ask you a personal question, Duke. You can hear me now, right?
Yes, I can hear you.
Are you overweight?
Yeah, about 10, 15 pounds.
Okay. So, I was just looking, I just heard on the radio at the break, it said 70 million people are obese. And then I went to my computer and I looked up how many are overweight, and it said 100 million. But then, what's the criteria for that? You say, well, I'm not really overweight. I'm just 10 to 15 pounds. But biomechanically, on the joints, like your knee joint, biomechanically, that 15 pounds, if that's what it is, times 5 is how much? 75 pounds. Is 75 pounds of pressure on your on your knee. I don't know what it is on the heel, but it may be more or less. So you're overweight to me.
Yes.
And to be honest, I'm 100 and what was I yesterday? I think I was about 167, and I'm about 6 feet. And to me, I'm about 5 pounds overweight. And you might go, but you're thin. And I go, yeah, I'm thin, but my fighting weight, when I was a gymnast, was 160. And that's really where my body, I don't like to use the word should, because then I'll be shoulding on myself, but I should be a few pounds lighter,
Yeah, I understand.
At the age of 74, I've got a teeny little tummy, and my wife hates when I say tummy. She says, call it your abdomen. She's a nurse practitioner. She says, you're a grown man. Don't use the word tummy.
Okay, I got the message.
Yeah, and so the spur is probably on the bottom of the calcaneus, which is overuse. I'm an
avid walker.
Yeah.
Avid walker.
Which is great,
Years.
which is great. It's great to get exercise, and walking is an amazing way to do it. So I don't think you have any problem with your foot. I think all that can be handled. I think we can help you if you wanted to do it. I think, using platelets and or stem cells would heal all that stuff up. The spur doesn't go away because it doesn't need to go away. It's not the issue. It's the attachment of the spring ligament on the bottom of the foot that's irritated. And then I'd have to look at your feet and see, what's going on. Sometimes we make orthotics if you're flat-footed or there's a problem with that to help support that arch so the ligament's not pulling on that bone. So I don't think you have I don't think there's any big problem with what's going on. The bone bruise is not a big deal at all. That heals up. It's like a bruise on your arm. It's just on the bone. But
will the PRP regenerate the tissue for the fascia, the slight tear in the fascia?
Yes.
Yeah.
So
okay, well,
I didn't hear an answer. I've asked a couple of times. Were you jumping at the rock concert?
Oh, that's when I cut out. No, I was not jumping. I was sitting most of the time enjoying the music.
Okay. Then why did you say it happened at a 3-day rock concert?
Well, I walked a lot, and I walked around a lot on those 3 days.
Okay, I gotcha.
Yeah, but
all righty.
But there was no incident that I can remember, and I'm not a drinker. So
it's just overuse.
No incident that I remember.
Yeah. It's just overuse. Most injuries that come in are overuse, and that's most of the injuries that happen to me are overuse. I can jump into a sand trap at my golf course and hit one shot for hours until I get it perfected that day. I love doing that. And the bad news is I'll go back the next day when I play and I can't even hit that shot.
Well, I'm 72, so I'm mature now, and things happen.
Well, you've hit midlife. That's all. That's the way I look at it.
Thank you.
God bless you, Duke. I love talking to you.
Thanks for all your help. I appreciate it.
All right.
Thank you, Doc.
All right, Nita, I'm going to give out the phone number so we can get some more callers. Tom, you hang in there. The phone number to talk to us live right now, I'd love to talk to you, is 866-870-5752. It's 866-870-5752. If you want to catch me at the office or get more information from my staff, the phone number at the office is 800-300-9300. If you'd like to email me at, you can do it through my website. I get emails all day. And you just go to www.lastemcells.com. And through the website, there's a slot on every single page to email me. And that's www.lastemcells.com. And you can watch me on a lot of videos I have there of doing these injections, seeing if it's something you want to do. By calling in now, Tom, we're going to send you a free book that I wrote. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got, what was it, Nita, about 268 studies or so.
Actually, 264. You're very close.
Okay, I overstated. On how regenerative medicine works, the science of it, and how the surgeries fail. So please, 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 if you're about to get an orthopedic surgery and it's not necessary, an emergency, please consider doing this to save yourself from all the potential side effects of having a surgery. I had it done once to me, and I suffered for years afterwards. I have patients that come in almost every day after a surgery that are suffering. I'm not putting down the surgeons. I love them. But these surgeries, in my book, shouldn't be done unless they are necessary. If they are optional, then don't do it. Figure out a way to help yourself heal. There's a lot of natural ways to heal. I like every way to heal except surgery, unless surgery is necessary. So it's not the surgeon that decides, it's you. So, Tom, you separated your clavicle from your acromion, your AC joint. Is that correct?
Yes.
And how long ago was that?
It was Monday. I've seen one. I got x-rays. I'm going to see my insurance company's orthopedic surgeon or doctor on Thursday.
Okay.
I went somewhere and had a consultation with another orthopedic this past Thursday.
Okay. And when you take a look in the mirror at both of your shoulders, is this your left or right AC joint separation?
The left shoulder.
Your left one. Okay. So when you look at it in the mirror, is the clavicle sticking up above the acromion?
Yes.
How far would you say?
Well,
a millimeter, an inch?
Almost an inch.
Okay. So if it's an inch separation, that's a really bad one. And that means that the clavicle is not even really articulating at all with the acromion. The acromion is the top of the shoulder coming from the wing bone in the back, right? And that may have to be surgically reduced and some wire put in there to hold it in place. Can you push it up and down with your right hand?
Yes.
Okay. Yeah, that's more of a surgical case. And I always say, I don't like surgeries unless they're necessary. And in that case, it may be necessary. You get my drift?
Well, I'm going to the mirror right now. Maybe it's not an inch.
It sure feels like it. No, it feels like a foot because it hurts. Did you fall off? Did you fall over that? Did you fall over the handlebars?
I fell hard celebrating the 4th.
Okay. The most common way I see this is people going over their handlebars. They hit the brakes too hard, or they're going over a hill or something like that, or the wheel catches in a rut. That's when it happens the most. But yeah, it can. Well, you just fell down, huh? Yeah, that can happen also.
Yeah.
So a grade 3 may or may not have to have surgery. Okay.
That's what he said. He recommended, but he said it would take the same amount of time to heal if I had surgery and let it do it on its own.
So on its own, it may just be an annoyance that will not be a problem later because it'll probably just fuse up, on its own. But that's between you and the surgeon. I was trained in orthopedic surgery during med school. I did a lot of it. During internship, I did a lot of it. During residency, I did some. But I never became board certified in it. I switched over because of my shoulder. I switched, surgery that went bad. I switched to what's called physical medicine and rehabilitation at UCLA, and that's my board certification. So when it comes to surgery, I don't make decisions for people. And I often send people to an orthopedic surgeon if I think there's a chance that surgery would help them. So again, I have to keep saying, I'm not against surgeons. I love them. I just think the culture of medicine is overstated, meaning there's too many surgeries being done that don't need to be done. And in your case, it's probably borderline, and you have to decide. Now, the question for me is, will regenerative medicine help that heal if you decide not to have surgery? Regenerative medicine would help it heal whether you have surgery or not. Okay, I have a lot of people with AC separations that still have pain afterwards, with surgery or without. And then I just take a teeny little needle, like a 30-gauge needle, and put some cells in there and get rid of the pain. What a lot of surgeons will do when there's AC pain is they'll actually cut part of the clavicle. They'll cut it off. They'll cut off part of the bone. And to me, that's absolutely insane because it can be healed. The pain can be healed usually very easily by just injecting some cells in there with a teeny little needle. You hardly even feel it. It's like an acupuncture needle. So Tom, why don't you, well, actually I'm going to have your phone number here, and you can always get a hold of me through the website. Every page on the website has a spot
I was
to
planning
email.
on emailing you.
Yeah, you can email me. You can go to www.lastemcells.com, and you can email me through my website, and we can stay in touch, and I can assist you in your decision of whether to have surgery or not, okay?
Great. Thank you very much.
God bless you, man. I hope that thing heals up good, and I'm sorry that you had that happen. That's, usually they come out fine, so hopefully yours heals right up.
Thank you, Tom. We appreciate you. You want to go to Linda?
I would. Your left upper thigh is bothering you, Linda. What's going on? How long have you had the problem?
Hi there, Tom. Nice to speak with you.
Actually, I'm not Tom. Tom is Tom is the guy that called in. I'm Marc Darrow. I'm the doc.
Mark, sorry about that. Hi,
No
Mark.
problem.
So,
As long as you don't call me late for lunch, I don't care what you call me.
I love it. I have had this pain in my kind of my upper left side for about a year, on and off. It's hard for me to walk. I exercise regularly. I do play pickleball. I do yoga. So
Good for you.
exercise is wonderful as far as I'm concerned for me. But when I'm exercising, I gimp around a little bit, but not too badly. It's when I stop, walking upstairs or trying to sit down with my grandkid. I'm 67 years old. And so I did go to a chiropractor for a while, physical therapy for about 6 months. Always feels better after physical therapy. But then, I wake up and, I'm kind of limping around on my left thigh.
Okay.
And the MRI, finally got an MRI. They said it's called severe, I think they said orthoarthritis.
No, osteoarthritis.
Osteo, that's what they said. Severe osteoarthritis. So I'm not
Of what? Of what? Your left. Hey, Linda, slow down. Linda, slow down. We have to talk together here. Is it your left hip that had the severe osteoarthritis?
It's not the hip itself. It's below the hip.
Okay, but what's below the hip? What's the item that we're talking about? What part of the body?
The left upper thigh.
No, there's no arthritis in the left upper thigh. It's the joint that can have arthritis.
Well, that's where the pain is, but they keep calling it the hip. That's my confusion.
Okay, so I said hip and you said no, not hip. So most likely what's going on is you have osteoarthritis in your left hip and it's radiating down. The pain is radiating down to your thigh. Does that make sense or no? Is that making sense?
It is, yes.
Okay. Now, do you have range of motion of your left thigh? Can you turn it? Can you bend it?
I can do all those things, but it hurts. Like
okay,
when
very
I
good.
do the yoga stretches, it hurts. Yeah.
Sure. Now, I want you to listen for a while because I have a lot of information for you. What I'm thinking is that the arthritis is causing a radiation down to your thigh, and that you could be helped with regenerative medicine using your own platelets and or stem cells to get injections there. I'm not promising you anything. I don't ever promise anybody anything. And I always tell people when they come in who have had a surgery, like we just had Tom call in, or was it Tom or was the one? No, it was Duke. Duke that had, no, it wasn't Duke. Who was it? Oh,
Tom.
no, it was
It was
Robert.
Tom.
No, it wasn't. Good try, Anita.
Oh.
It was Robert. He had
that had this, from earlier in the show.
yeah,
You're right.
he had a meniscal tear. They
Yes.
told him his knee would be 100%. It's not. And that's what I hear all the time. People come in, they said, I had a surgery. I'm not better. I'm a little bit better. I'm a little bit worse. The surgeon told me it would fix it 100%. It didn't. So I don't think doctors should be doling out, who's going to heal and who's going to not. We don't know that. We can say based on our experience that this many people heal, this percentage, but we don't know what's going to happen to you. You're an individual in an experiment of one. Every person is different. But I'm gonna say this not as your doctor, Linda, but just as education. I have tons of people with hip arthritis that have no pain. Now you're going to go, well, how can that be? I have hip arthritis and I have pain. Because having hip arthritis doesn't necessarily cause pain. It can, but it may not. I have people with arthritis all over the body that we find serendipitously when we're looking at other things, and we go, by the way, did you know? Well, darn it. Linda,
dear.
I'm gonna talk to you later. I'm gonna call you. I have your phone number, and I'm gonna sort this out with you. But anyone who's interested in this work, go to my website, www.lastemcells.com, and you can email me right through that website on every page, and you can watch videos. Thank you, Nita Valens. You're a great host. Thank you, Suzette. Thank you, Alex, and the whole staff. God bless you all.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, You can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.